Hi guys, this is Dr. Mike from the Pain and Wellness Group. If you've ever had knee problems of any type, knee pain, know somebody that has knee problems, this is a must-watch video. I'm going to break it down really simple for you, what the knee joint is, different types of problems that arise, what arthritis is, and basically what you can do about it to help yourself. Okay, so let's start here. The knee joint is a complex hinge joint. Okay, so the hinge joint moves like this. Okay, now there's soft tissue around it, which would be muscle, ligament, tendon. You also have your kneecap that lies over top that joint called your patella or just kneecap. So let's just go ahead and start here. There's different types of things that can happen to damage your knee. You know, let's start off whenever you're a baby, whenever you start actually walking. If your gait or walking, if your gait develops improperly, what will happen is your muscles will start to pull your kneecap different ways than it's normally supposed to go. It'll make the joint have extra stressors on the inside or outsides, of the joint. You could be an athlete and damage it in some way, causing inflammation, or you could just have a fall, or a car accident or something like that to cause problems within that joint. So let's break down, what happens to the joint. Let's look at a normal one versus an abnormal one, and basically different things that you can do about it. Okay, so come on with me here. So this is a normal joint space. This is a knee. This is an x-ray of a knee. Okay, we're looking straight on. You can see this nice space through this joint. Okay, nice space. So that joint is actually able to move freely without stressors in it. Okay, now there's soft tissue in here. It's called your meniscus. Okay, it's basically like a cushion for your knee joint. Okay, this is very, very important. Now, let's look over here at an abnormal knee. Okay, so if you look here, you see right here how you don't see any joint space? This is the classic bone-on-bone knee joint, okay? Now, what happens with this, if we don't get space in here, what'll start to happen, well, actually it already started to happen, but what happens every day, every time you walk, every time you get up, walk upstairs, walk downstairs, you're literally ripping and grinding that soft tissue away, or your meniscus. So you're literally deteriorating your knee joint. Okay, now you need to do something about it right away. Now, is there something you can do about this? Absolutely there is. Now, the idea is we want to keep you away from surgery forever, if not forever, for as long as possible. Surgery is the absolute last thing you should ever go and do. We want to keep our own natural joints and bones and everything in our body. We want to not have fake things in there. Your body just doesn't work properly that way. Now, if you have to do it, you have to do it. You go down that road. We do a really great job, replacing those types of joints. But nothing beats the real ones. Okay, so this type of thing. Let me kind of just give you an idea of what we do in our office, and then we'll kind of go from there. Now, what we do in our office, we'd have one of our knee specialists, look at your knee and tell you, number one, if you can do anything about it or not. So, that's the most important thing. Now, what we can do, we can actually put a substance in this joint, basically like oil. It's a natural substance. It's oil within the joint, so it stops that friction, stops that grinding, which is, what we want to start with first. Then what we can do, we can actually do specialized bracing to push the knee this way to open up that joint space right here. Okay, so just imagine this. Now we have oil in the joint space. We just open this part up because what's the idea is we want to stop the knee from breaking down. That's the key. We want to stop that breakdown process so it doesn't get any worse. Okay, so we have the oil in the joint. We have the specialized bracing. Now what we do is, we have protocols that we have a stretching protocol and a strengthening protocol. Okay, so we can actually start that stretching protocol. We'll start to get that knee back in that full range or as close to full range as possible. And then the strengthening phase goes along with keeping that joint moving properly. Now, we have great success with these protocols with knee joints. Again, we want to keep you away from surgery forever, if not forever, for as long as possible, because the real joint is the real one. Okay, so that's the one we want to have in our body. That's the one we want to live with for the rest of our life, or like I said, as long as possible, because that's what's going to help your body function the best. Now, if you have knee problems, if you have different issues that you want to get checked out, please call the number, then click on the link below. We'll have one of our specialists look at you. We have two offices, one in the Villa Park, Illinois area, and one in the Plainfield, Illinois area. So you have two different options there. And we have one of our specialists. You don't have to live right next to the office to get these types of procedures done. So, if you have different issues, please click the link. call the number. We'll be happy to check you out with one of our specialists. We'll be able to tell you exactly what we can do, with your knee, even if you've been told there's nothing you can do. We've had that a lot in the office. Please click the link or call the number and let one of our specialists tell you what they can do. Thanks, guys.